Hello class, my name is Jody Todd and I'm here today to speak to you about the strategic plan for bedside report. I'd like to thank Dr. Barry Atkins for all of his support throughout the class, as well as yourselves in listening to all of my presentation. Throughout this presentation, we'll be going over the bedside handoff and improving communication at the bedside, review statement of the problem, overview of the project, review of the SWOT analysis, mission and goals, strategy plan, drivers for organizational success, process impact, stakeholder analysis, perspective, learning and growth, action plan and strategy, evaluation of the strategic plan, and a conclusion. Healthcare is an ever-changing field with focus on the client. This connection between evidence-based practice and organizational goals are seamless. Focus on this continuum supports an increase in client satisfaction, improved safety for the client, and fluidity within the dialogue from shift to shift, department to department, and facility to facility, ensuring the connectedness within the organizational handoff. Ineffective handoff can contribute to gaps in client care and failures in client safety, including medical errors, medication errors, surgery performed on the wrong site, and even death. Transition of caregivers during handoff are complex and vary between nursing staff based on many factors, from educational gaps to communication differences from nurse to nurse. However, standardizing the handoff procedure promotes the opportunity to ask questions from not only the nurse, but also the client and the family. Connecting the client and family in their care delivery is platinum. This connection supports clients, families, and their involvement in education and of the plan. Transition of bedside handoff report is essential in providing the best possible care for the client. This method covers a connectedness to the plan of care, including code status, history, allergies, physicians, medications, assessment findings, IV lines, tests, results, discharge planning, and involving the client and family in this process. This project will review the SWOT method of meeting organizational goals, including strengths, weaknesses, opportunities, and threats. Through this strategic mapping, action plans, communication, evaluation, and finally presentation of the findings, the bedside handoff will create a culture of active participation in nursing, education for the client, improved client satisfaction, and fewer adverse events related to poor compliance and communication during handoff. This SWOT analysis on how to improve communication during shift handoff includes the strengths, weaknesses, opportunities, and threats. Please review the content. In Honoring Health, our mission statement is to improve the health and well-being of those we serve. Through a connected community, improving the health and wellness. This connection within an organization supports and develops a holistic treatment plan that involves the client, family, and team to ensure confidence through the wellness and illness process. Stakeholder goals for developing a working relationship between bedside nurses and clients, developing trust within dialogue, involve them in their care through a connectedness of strategic medical exchanges, developing and meeting the expectation toward enhancing the experience. This strategic map accomplishes the mission and creating of value through financial performance, customer service, internal process, learning, and growth. Key drivers for organizational success include growth potential in the client base and retaining exchange, manage and measuring data, creating better outcomes through accountable care organizations and their profitability, consumer demand and the risk with innovation, maturity, and value. Through this model link, identifying and progressing with the care delivery from a connected approach also supports the medical record. Operational process impact can be an overwhelmingly important process tool. This connects a streamlined process and cost infrastructure, industrializing the business process, and also working in a government framework that can measure outcomes. However, with public, they do not understand the whole one-size-does-not-fit-all mentality, as well as the client not bearing the interest of the enhancement of government and its process. Stakeholders come in a variety of arenas, including its providers, payers, employers, and patients. With this, it creates a check and balance system to ensure high-quality care delivery upon pre-hospital, inpatient areas, and post-hospitalizations. Action within an operation is essential to connect direction, review, ongoing input, maintaining accountability, advising on education and concerns for the client, and support a strategy for enhancing the experience to become involved in care delivery through modeling the exceptional care that is deserved. Strategically speaking, handoffs are held to a different standard at all facilities. With this knowledge, it is essential to create communication between not only the nurse to nurse, but also involving the client and family. Decreasing the risk for error is essential in caring for others. This educational opportunity sets the standard for safety through knowledge and accountability, which leads to a decrease in stress and enhances the communication between client, family, and nurse. Stakeholder analysis uses a powerful tool to keep patients satisfied, manage them closely, monitor their progress, and keep them informed. From a financial perspective, decreases in errors, decreases in litigation, and increases in customer satisfaction, leading to an increase in return of customers, provides our increased compliance from clients when they are involved in their care delivery. Through this, a continuous influx of information via the internet and word of mouth also brings hospitals in a continuous financial advantage through high customer satisfaction scores and positive experiences in facilities. Customers in today's busy world acknowledge the bedside report as a time to improve care, connect with the new nurse as a partner in their care, seeking out the important aspect of involving the client to be a part of amending care inaccuracies, as well as taking on the ability for a passive approach to care through family opportunity to engage in the process or when a request for rest is desired. Connecting the internal environment stems plenty of opportunity for growth personally, professionally, and for future experiences. This internal perspective guides care and supports on many levels from the stakeholder to clients. With this expansive window of opportunity, it is the right thing to involve the nurse, client, family, and promote opportunity where it begins, at the bedside. From a learning and growth perspective, supporting the mission to guide care, assist directors with a view on the motivation to enhance that moment. Evidence-based experiences, commitment to a high quality of care, including accountability through an SBAR handoff using the electronic medical record, as well as exposing to the learning process for clients' perspective and compliance with the handoff mandates. Stakeholders assist in the developing and transition to support and trust within all parties, providing a strategic medical exchange backed by a connection to meet and exceed the expectations of the consumer, family, treatment team, and promote wellness within the community. Departments within the strategic plan involved in the transition of care comprise the nurse-to-nurse handoff, nurse-to-technician handoff, doctor-to-nurse updates on the plan of care, new treatment plans, and nurse-to-nurse, client-to-family. Dialogue is essential in the connectedness within the plan of care delivery, supporting each and every interaction, promoting question and answer sessions for the plan of care to remain clear for all parties involved. Business function and the impact on the plan includes a connectedness through management, competitive advantage, contingency planning, building scenarios, crisis planning, and innovation. Through this, involving all departments, assist in everyone having a powerful voice in their transition. Action within an operation is essential to connect direction, review ongoing input, maintain accountability, advise and educate on concerns for the client, and support a strategy for enhancing the experience to become involved in care delivery through modeling exceptional care that is deserved for each and every client. Action within the impact on the planning includes insurance companies, accountable care organizations, high customer demand through innovation and research. With this, consumers are demanding a quality support in developing healthy communities within their healthcare. This also includes an integrally related process matrix that is processed and developed in a combination with support to ensure a high quality of care through the bedside handoff involving the client in their specific goals and learning experiences. Strategically speaking, handoffs are held to a different standard at all facilities. With this knowledge, it is essential to create communication between not only the nurse to nurse, but also involving the client and family. Decreasing the risk for error is essential in caring for others. This educational opportunity sets the standard for safety through knowledge and accountability, which leads to a decrease in stress and enhances the connection between client, family, and nurse. Leadership strategy within the organization seeks results through accountability. This is demonstrated through behavior. Employee populations that do the right thing with a sense of ownership creates an importance in what they do through supporting work in an hour mentality of supporting strategy through action. Team collaboration within the organization must emphasize the importance of creating widespread connectedness to ensure pertinent, essential information during handoff is delivered efficiently. This team collaboration supports communication, decreases in errors, the opportunity for education, promotion of safety, decreases in stress within the team through knowledge in a relevant aspect through the plan of care. Strategy implementation in developing programs based on communication and fact create organizations demanding highly credible communicators that focus directly toward the goal of 100% of all bedside report being delivered based on a team approach developed within the nurse to nurse, patient to nurse, family to nurse, as well as the physician component when available. Formal communication developed within the team approach are the standard of care demonstrated by the organizational policy. The standard of care delivery must be completed at the bedside within the communication circle of the patient and family and questions permitted. The care team must review the plan of care, medications, review of the intravenous lines, drainage tubes, patient history, code status, and any finding on request from the nurse, patient, or family. As well, informal communication of the interaction may be away from the bedside for a review of sensitive aspects of care. For example, past medical history that the client requested no sharing of confidential information for friends and family, i.e. drugs or alcohol indicators, and anything that may be sensitive to the patient. Informal communication is essential for the handoff, however, not for formal documentation or knowledge for visitors. Communication within the handoff delivers challenges. However, when insight into the plan and support of the knowledge in achieving the strategic goal of gaining knowledge through patients, families, nurses, and physicians, an organized evaluation plan can increase achieving the goal of 100% involvement of the bedside handoff. Evidence of the vision includes developing a sense of global impact, developing champions at the bedside, and knowledge of the expectation. Developing a sense of global impact on a better future in care delivery beginning at the bedside is essential to caregivers creating a passion for decreasing errors, learning opportunities, engaging the patient and family involvement in their loved one's care, supporting the sense of ownership for the profession, the devotion to organizational goals and standards, as well as a vision for health and wellness. Developing champions at the bedside enhances the policy and promotes the level of care and handoff. Bedside nurses have the power to improve the safety and quality through engaging their patients at the bedside. Examples of involving those in their care are reflective of the teach-back method, demonstrating learning based on patient understanding and ability. Autonomy in care for those in the critical care areas are limited, relying on family members and loved ones to advocate. However, when able, nurses engage the patient in handoff demonstrated by neurological assessments, ensuring no change in what is observed previously are not deteriorated. Knowledge of the expectation of bedside handoff is depicted through careful evaluation of the nurse-to-nurse connection with the team as a whole. The practice and rationale for guiding practice strategizes the challenge, the expectation, and the consistency driven by shift. Leadership and managerial skills require evidence of the goal and objectives, plan insight, and knowledge of the plan. Leadership in support of practice change is essential in acknowledging the importance in involving the patient, family, and healthcare team. Leaders must be present in assessing the goal and recognizing the consistency and possible lack thereof. The presence of supporting policy change are involved. Providing constructive feedback through monitoring and research based on information is essential for the bedside nurse to understand policy change and developing the tools to strategize the communication. Healthcare facilities are growing in numbers for the importance of peer review, and with this pressure from lateral perspective bedside nurses evaluating practice based on the tools and guidance developed. Support for the goals and objectives are no longer kept to organizational standards. They are publicized on the internet through patient satisfaction reviews, emails from providers to assess feedback from an impartial point of view following discharge. Healthcare research and quality guides the basis for rationale and support of bedside handoff. This study guides the practice and helps patients and families as the bedside nurse's working partner with care. Bedside handoff report benefits patient and family involvement. Developing knowledge based on understanding and care through explaining the patient role benefits consistency in care, assists in patients and examples on how to call the nurse, teamwork in their care, and develops relationships and decreasing the feeling of abandonment during shift change. Communication is crucial in the healthcare field, and developing a plan for the expectation of the possibility of change can be vital to the insight and delivery of care. Knowledge of the plan is not always clear. However, when the plan is unclear, obtaining information for creating connectedness in care far outweighs the uncertainty in care delivery. Searching for the answers is not always easy to achieve. Seeking out resources in the medical record can be a good source, as well as calling the physician to obtain information assistance and acknowledging the family and patient as the importance in their care. Through knowledge gains empowerment, with expectations facilitating the importance of care delivery beginning with shift handoff. Evaluation of the plan includes connection to the plan, evaluating the policy, training, compliance timeline, review of the plan with a high quality care at essence. Engaging the commitment for long-term performance for the organization benefits everyone involved. Through this, gain in ownership, everyone benefits. Evaluations offer the opportunity to review the options, strategy, and long-term objectives. Through this review of the strategic plan, adjustments are created to maintain compliance at the bedside. In conclusion, bedside report handoff is epic to caring for the client. Clear communication and involvement from all involved parties are essential to care. Creating change in the culture from nursing station report to bedside report with a clear delivery system develops a relationship with the client and family representing an investment in their care and decreasing possible adverse events. Creating a strategic plan based on mission through referencing stakeholder goals creates driving forces to enhance success. Success is delivered through a connected impact of operational process, stakeholders, and goals. This connection brings rise to opportunity financially, customarily, internally, and through knowledge and growth within. Creating support and communicating the plan is essential in developing and maintaining policy of 100% compliance to the bedside for report handoff. Demonstrating strategies with formal and informal channeling of the knowledge and understanding creates goal attainment through support based on knowledge and evidence-based findings. Leadership at all levels of care, beginning with the bedside nurse to managerial level of oversight, must be in accordance and understanding of what the policy demonstrates. With this knowledge, great things can become reality. Thank you, and have a great day.